Let's discuss an interesting case of 45-year-old female patient presented with low back pain which was radiating to left side followed by a trauma. Lumbar spine examination, hip joint examination and sacroiliac joint examination revealed no significant abnormality except for mild widening of sacroiliac joint space and reduction. However, if you closely look at piriformis muscle on left side, it's absolutely normal at the greater sciatic foramen just below the sacroiliac joint. Here, however, this side there is definite discontinuity of the fibers of piriformis muscle with ragged borders and subtle hyperintensity and a small hematoma overlying a sciatic nerve on the left side. If you closely observe the sciatic foramen, the piriformis muscle signal is much iso-intense here compared to left side. The piriformis muscle is bulky and it is more hypointense. This is the sciatic nerve which is piercing and coursing through the piriformis muscle. So there is definite hyperintensity of the sciatic nerve in this case. So this is a classical case of piriformis syndrome causing perineural hyperintensity. Piriformis syndrome is nothing but it's also called pseudosciatica or wallet sciatica or deep gluteal syndrome. It is caused by the irritation of proximal sciatic nerve by compression of it. So it is more of a diagnosis of exclusion when no disc pathology or when there is no hip joint pathology or a sacroiliac joint pathology. You should always look at the proximal sciatic nerve and piriformis muscle. So what are the classical features? Pain radiating from the sacrum, pain when rising from sitting position, and pain improves with the movement. So these are the classical features of piriformis syndrome. Imaging clues for the diagnosis are looking at the piriformis muscle just at the piercing of sciatic nerve, proximal sciatic nerve is a helpful imaging clue. You can, in relatively later stages, you can see the muscle atrophy of the piriformis muscle. You can also see sciatic nerve asymmetry in cases. So T2 weighted will definitely show you the perineural hyperintensity adjacent to the sciatic nerve. When there is early atrophy, you can see muscle hyperintensity. Late atrophy will show you muscle hypointensity. Sometimes you may see an extrinsic mass lesion compressing on the piriformis muscle. In our case, there was a small hematoma which was compressing on the piriformis muscle and also the sciatic nerve. In T1 weighted imaging, you can see atrophy of the piriformis muscle and also the sciatic nerve enlargement. This is the piriformis muscle illustration showing piriformis muscle which is taking origin from S2, S3, S4 vertebra and inserting into the greater sciatic foramen. So this is the sciatic nerve which you are seeing, and it is piercing and coursing through piriformis muscle. So just to show the other anatomy, this is the gluteus muscle, gluteus minimus muscle. This is the gluteus medius and this is the gluteus maximus muscle, and you can see the classical piriformis muscle of left side. So here in our case, there was definite T1 weighted hypointensity of the piriformis muscle. So this is the sciatic nerve, and also here some fibers of piriformis muscle appear torn with hematoma adjacent to it. So this is a classical case of piriformis syndrome. Another companion case in a patient with right side radiculopathy, the sacroiliac joint and other hip joint and lumbar spine were normal even in this case. You can definitely see the bulky hyperintense piriformis muscle with perineural hyperintensity. So this is a case of another right piriformis syndrome. Here you can appreciate the muscle atrophy in this case on right side in T1 weighted imaging. Thank you very much. Hope this video on piriformis syndrome is useful for you.